Ever wonder how AI is learning to see and understand medical images in ways that could revolutionize healthcare? Let's dive into cutting-edge research that's redefining how machines interpret scans, from X-rays to retinal images. Here's the challenge. Training AI to diagnose diseases from medical scans is a complex puzzle. Traditional models rely on labeled data. Think of it as teaching a child to recognize a dog by showing them 10,000 labeled images. But in medicine, labeling scans is time-intensive, costly, and often requires expert radiologists. That's where self-supervised learning shines. It's like teaching a child to identify animals by showing them unlabeled pictures, then asking them to describe what they see. The AI learns patterns on its own, but it often lacks the contextual depth to distinguish a scar from a tumor or fluid buildup from normal variation. Enter RetFiner, a breakthrough system that bridges this gap. Instead of relying solely on images, RetFiner pairs medical scans with clinical text from patient records. Imagine showing an AI a retinal scan and a doctor's note. Fluid accumulation in the macula suggests age-related macular degeneration. By linking visual data with textual context, RetFiner teaches the AI to recognize not just shapes, but meaning, like understanding that a dark spot isn't just a shadow, but a potential sign of disease. How does RetFiner work? It employs 4 specialized training tasks to refine the AI's understanding. First, Image-Text Contrastive Learning, ITC, aligns scans with their corresponding clinical notes, teaching the AI to associate visual patterns with specific diagnoses. Then, Masked Language Modeling, MLM, hides parts of a doctor's note and challenges the AI to predict the missing words, a linguistic puzzle that strengthens its grasp of medical terminology. Generative Modeling, GM, pushes the AI to describe an image in its own words, forcing it to articulate what it sees. Finally, Image-Text Matching, ITM, tests whether the AI can verify if a scan and text description align. Together, these tasks act as a mental workout, sharpening the AI's ability to think like a human clinician. The results speak volumes. RetFiner achieved a 5.8% accuracy boost across 7 critical tasks, including detecting rare retinal conditions. In medicine, even a 1% improvement can mean the difference between early detection and missed diagnoses. What's more, the system's open-source code empowers researchers worldwide to build on this foundation, accelerating innovation. But this isn't just about numbers, it's about transforming healthcare. By integrating visual and textual data, RetFiner creates AI that doesn't just see, but comprehends. Picture a future where AI analyzes a simple eye scan to flag early signs of Alzheimer's or diabetic retinopathy, enabling timely interventions. This is the power of systems that learn from context, not just pixels. So next time you hear about AI in medicine, remember, it's not just about algorithms. It's about tools like RetFiner that are learning to think like doctors, bridging the gap between data and real-world impact. Stay curious and keep exploring the frontier of AI-driven healthcare.